When trouble arrives and stares in our window, blocking out all we can see, we ask ourselves the same old question: who will be there for me?
Welcome to the second show in a continuing series of healthcare updates. I'm Richard Davis. I'm the Executive Director of the Vermont Citizens Campaign for Health, and I'm here with my sidekick,
Daryl Pillsbury, and we're here to talk about healthcare-related issues. And I think this week, Richard, we're going to focus on the misconceptions of what this bill does, aren't we?
we're going to talk
Try
about...
and help people out a little bit.
What we're going to do is we're going to talk about a little bit about the federal health care bill that passed in March, called the Patient Affordable Care and Protection Act, something like that. And what we're going to do is give people a sense of what's really in the bill instead of what they've been scared into believing is in the bill.
Because there are, in a lot of the polls, when they ask the true or false question about the new health care law, about, like, will it cut Medicaid benefits for seniors, and will it slash Medicare, or Medicare payments to doctors? Is it going to ration health care? And in 3 polls conducted just in the last month, a large percent of Americans answered true to every one of those questions. And it's not true.
Right.
And maybe you can explain, Richard, how that isn't true.
All right. Well, let's get into some of these details. First of all, let's backtrack a little, because the history of this bill politically was that even before the bill was passed, you know, the insurance companies, the drug companies didn't really want a lot of this bill to pass. So those entities and other political groups put out ads and misinformation. And if you remember, one of the biggest ones was the death panel thing.
Yeah.
So let's
Sarah Palin special.
Sarah Palin special. So let's backtrack on that, because people still think that's in the bill.
Yeah.
Okay. What the death panels referred to, and it was actually a very good provision that was in the bill, but Harry Reid took it out because he was so afraid of the attack from Palin and her supporters. He didn't think the bill would pass. What was that all about? There was a provision in the bill that would have paid doctors a little extra money to sit down with their patients on Medicare and talk about end-of-life decisions, like, do you want to be resuscitated if you do or you don't, and what kind of care would you like at the end of life, because a lot of doctors just don't have the time to talk about that stuff with their patients. This would have reimbursed them to do that. But Sarah Palin turned it into this political death panel lie that it just wasn't true. But so it's not in there, and it would have been a good thing to have it in there, but it's not in there. So let's get rid of that first, because that's gone, and it's not in there, even though it should have been. Okay.
And then how about the myth about you won't be able to see your own doctor?
Another lie.
Another myth.
Okay, that's a lie. And another big lie, this is one that especially relates to Medicare, because there's some lies that don't relate to Medicare. But another one is that Medicare, the funding's being cut so much that all your benefits are going to go down the tubes and you won't have your Medicare coverage. And that's an outright lie, too. So what is that based on? Okay, here's what that's based on. In the Medicare program, there are 20% of the population has decided they want to have the private insurance industry cover them rather than completely through the government coverage program that exists. So this started with the Bush administration, but it continued. And what it means is that private insurance companies, if they are willing to offer the Medicare benefit package and then they can add anything they want to it, they get reimbursed at a higher rate than the regular Medicare providers.
Right.
And insurance companies. So it turned out that legislators realized they were spending a lot of extra money on these Medicare Advantage programs for no reason other than to help privatize Medicare, which really doesn't seem like the right way to go. So what this new bill did, it said, okay, we're going to level the playing field and we're going to pay the Medicare Advantage people the same as everybody else gets, which, you know, only makes sense. So a lot of right-wing politicians and other groups twisted this and said, oh, we're cutting Medicare. There's almost nobody in Vermont, very few people in Vermont even have these Medicare Advantage programs. But 20% of people on Medicare migrated to them. And just to show you how bad they are, these are the kind of programs where if you're on a regular Medicare benefit, you can see any provider anywhere in the country. There's no gatekeeper. There's none of that. If you go on these Advantage programs, generally you have to stay within the network, and then there's co-pays and deductibles that are different. It's much more complicated. People that end up using the Medicare Advantage, if they get sick, quickly go back to the regular Medicare program. People who are over 65 and relatively healthy might like it because it might cost them a little extra money, less money, or they might have better benefits. But once they get sick, they realize that it's not a good program. So one of the estimates I saw would add $133 billion over 10 years to the Medicare Trust Fund. And the CBO, the Congressional Budget Office, that estimates all these money things, estimated that Medicare would remain solvent for 12 more years as a result of these cuts. So any federal program that you can say is going to be solvent for 12 years, that's tremendous in political terms. So,
yep, that is true. Richard, do you want to get into what this does with the donut hole, or do you want to say that for another time?
Let's talk about it.
Because that's a pretty big problem that we have for folks.
Yeah, it's tremendous.
First, you might want to explain what I'm talking about with the donut hole.
Right. I've been going around, actually, Windham County and other places, explaining to people some of these, what the changes to Medicare are under this new bill, and just about all of them are good changes. So one of the changes that Daryl's referring to, if you're a Medicare beneficiary, you can, this is purely voluntary, you can sign up with Medicare Part D, which is a drug benefit under Medicare. Now, it's very complicated, but you sort of have to look at what you're taking for medications and compare it, and then this is all administered through private insurance companies. If you decide to sign up for the Medicare Part D drug plan, there's a gap in coverage, and it's a $3,600 gap. So I think when you get to like around $2,400 that you've spent on drugs, the next $3,600 you have to pay 100%. This is called a donut hole. It's a completely ridiculous thing. It was just done to save the the insurance companies money, and Congress didn't have the guts to just stop this completely. So they're phasing it out. And it won't, I think it's not going to be till 2017 or till it's completely gone. But what they've done is, if people fall into this donut hole, this $3,600 gap, they're going to get a $250 rebate check. You know, big deal. I mean, it's something, but until they finally close the gap, which they're going to do. You know, 51% of people that were surveyed had no clue that this coverage, the donut hole was going to be decreased. So we still need to get the word out. So that's, I don't want to get into all the details of the donut hole, but that's basically, you know, that $250. But I just want to, it's sort of a political slam, but I have to say this. When the Douglas administration found out that Vermont beneficiaries on the Medicare Part D might be getting this $250 rebate.
Oh, yeah.
They started a campaign to tell Vermonters, or they actually wanted some legislation to force Vermonters to give the money back to Vermont. And that didn't go over too big, so that died pretty quick. It was kind of a dumb idea.
Yeah, I don't know what it would have done. Well, you know, in all fairness, they're trying to find every nickel under every rock.
Well, and the other part of it is that the state does subsidize a lot of people in the Medicare Part D program. So, you know, it was sort of money coming back that they've already given people. But still, you don't take away a check from people. That's not a good idea.
And one of the reasons why we decided we'd talk about this stuff today, the lies that are out there, that's one of the things that kills me, folks. I've been involved in trying to get health care reform since 1992. Richard's probably been involved with it a lot longer than me. And when it's just incredible that we keep going down the same slope we're going, where there's no end in sight. It's time for something different. We have a good bill that came up before us, and then we have folks out there, and I don't care what party you're in, when you're scaring people and telling outright lies, that is just plain wrong. And I sure wish people would stop doing that. And anybody who thinks what we're telling you is a lie, feel free to come on, have your own show, and tell us what we're wrong about. Because I wouldn't even mind debating somebody that thinks we're all full of crap. Get somebody here that gives you both sides, and let the people figure it out. Because I'll tell you, it really does upset me. Like, here's some other good stuff. I think part of this bill, the reform promotes quality and coordination of care, which I think is very important. And you know how that does help in the long run. Maybe you could talk a little bit about that. You know how it promotes primary care, promotes coordination of payments among doctors and hospitals, encourages providers to work together. I mean, I know some of that's being done now, but maybe you can go further with that, Richard.
Well, some of the details on that, part of it is pie in the sky, and I'm not sure it's going to play out as nicely as they think it will, but the effort's there. There's a recognition that there aren't enough primary care providers in the country. I mean, just in Brattleboro alone, how many doctors you call up and they say they're not taking new patients. So the shortage is here, and how do you fix that? Well, this bill has sort of long-term and short-term fixes. One of the long-term care fixes is that they're going to provide loan forgiveness for doctors that become primary care doctors. So if you're in medical school, you're finishing your training, you have a big debt, they're going to help them with that debt if they become primary care providers, because primary care doctors don't make as much money as specialists, and so all the people graduating from school with big debts want to make the big bucks. So that's a big problem. The other thing that it does as an incentive is to pay primary care providers a little more for some of these counseling and integration coordination services. Now, whether or not that's going to help, it's not a lot of money. It's a small amount of money. And I actually talked to one local doctor who told me that he said, well, it's a nice idea, but how am I going to find the time? I don't have the time now to do it, and just a few bucks isn't going to make a difference. So there's a problem because there aren't enough providers, and they don't. In the system we have, or the non-system, they really don't have enough time to do this kind of coordination and care that they'd really like to do. So throwing money at it, I don't know if it's really going to help, but at least it's a start, so they're working on that. So a couple more, we'll talk about some of the Medicare stuff, and then there's other things in the bill, but another important thing is that this bill cuts copays and deductibles for prevention.
That's big.
Prevention. So up until now, if you're a Medicare beneficiary, you couldn't just walk into the doctor once a year and say, I want a physical. You'd have to pay out of your own pocket unless there was a problem. Now, it'll pay for what they call wellness visits, which is really a physical. So you can go in once a year and say to the doctor, I'm on Medicare, have me check me out or do a physical, and that'll get paid for. The other thing it does is that it eliminates copays and deductibles for things like mammograms and colonoscopies and pap smears. So that's big too, because there was copays for that up until now.
Which a lot of people don't get the service that they need because they didn't do that first step, because it cost them maybe $15 to go. And believe me, $15 for some folks makes a lot of difference. And by putting this in the bill, now they can go, not worry about that $15, and hopefully we can find problems before they become more costly,
right,
which we know is a big problem.
Absolutely, and costly, and if you have a colonoscopy and they find a little polyp and they remove it, that's pretty simple, and that's the end of the story. If they go in there and they find a tumor, that's a whole nother story, a tumor that's advanced and growing and bigger.
But by not going for that physical and keep waiting and waiting and waiting, hopefully now, because we do know, we've heard testimony when I was in the State House, tons of testimony on how preventive care saves us a lot of money in the long run, and I forget what the $1 in preventive care saves you.
It's tremendous.
It's quite a bit.
And if I'm correct, I think there was a bill last session that requires the insurance companies in Vermont to not charge a copay and deductible for everybody else for colonoscopies and some other preventive services. Colonoscopies aren't cheap. I looked into the pricing. I think you could run anywhere from $3,000 to $5,000 or $6,000 for colonoscopy, depending on where you go. That's a whole other story. But for somebody like me, it would have been possible to I would have had to pay like $3,000 before I had one, you know, if that was my deductible. But and then, you know, I'm fairly savvy about insurance stuff, and I didn't even realize until I had a colonoscopy that my insurance didn't require a deductible. And I went in thinking I was going to have to pay a $3,000 deductible, and then I never got a bill. So, you know, and I waited like over a year and a half, 2 years to save up the money, and then I didn't even check with my policy, and it was already covered. Well, how did I know? You know, it's like
and like you said, you usually are paying attention.
Yeah.
I know you help a lot of other people.
Yeah, but I couldn't believe it. You know, I waited all that time, and then there was no reason to wait. So that my wife ran out of excuses, so she had one too. So okay, so that's some of the Medicare stuff. So then there's stuff in the bill, provisions in the bill that apply to other people. Now, I'd be curious what you had to think about the young adult part, the coverage. So one of the provisions in the bill allows children to stay on their parents' plan up to age 26. So what do you think?
Well, personally, I like that, being that I have a lot of children. Now, my kids are all enrolled in colleges which provide health care if the family doesn't have health care. So we have to send in a form from the school, and I wish they'd make it a little simpler actually, but we have to send in some forms, and my kids stay under mine as long as they're in college anyway. But
do you
this
have
right
to pay
here,
extra for that?
No.
It's part of the
It's
tuition?
just part of it. Yeah. Well, no, you would have to pay extra if you went through the kids, but if the kids went through the school, but because my kids are not going through the school, they're staying on my insurance, it does not cost them any extra. I still pay the family plan, and they're good as long as they're enrolled. When does this kick in?
I believe it kicks in January 1st, and there was, and it might have been, yeah, okay, that's right. It's January 1st, and there was some controversy over this, January 1st, 2011.
Yeah.
The problem was a lot of the insurance, the kids that are, they graduated from college in the spring, they're going to go uncovered for a long period of time, and so Obama administration, some other people, they didn't make it, you know, they didn't put it into law, but they asked insurance companies if they would like to start early. And a lot of insurance companies did, realizing they'd actually probably save money.
In the long run.
But here's the other side of this that you're not hearing a lot about, is that, okay, they're letting children up to age 26 on their parents' policies, but they're allowed to increase the price of the policy. And it's not cheap to do this.
Right.
So there's no price control. So there's no price control on it. So you really, it's going to cost a lot more money to do this for this privilege. So it's not, as you know, it's one step forward and one step back. It's not great, but
yeah, it's a little money maker for the insurance companies.
A lot,
because they'll be able to cash in on that one.
Right. That's why so many insurance companies decided to offer it before they had to, because you know they don't do something because it's the right thing to do. I mean,
right.
So
it's all about money.
So
well, that's the problem anyway that I have when I argue with a lot of folks who aren't into the single payer or the self-insured type of plan. It's the philosophy behind it. My philosophy is that healthcare shouldn't be based on a market-based, profit-based business plan anyway, where other people think it should. And to me, that's the biggest problem that we have in this country is we totally base the healthcare system on people's profits and CEOs making way too much money. It's just unbelievable to me. So I hope the whole bill, when it's done, actually control some of the cost of managing, you know, the healthcare system, because I think we got to put a cap on what some of these CEOs are making. And I don't mean in the private sector. I mean just CEOs of these hospitals and stuff. It's quite a lot of money.
Well, it's out of control.
Yeah, it really is. I mean, when you look at what's happening there, listen, I don't know what else you want to talk about. What about the high-risk coverage, which you did talk about it somewhat with the pre-existing conditions and who are uninsured and need at least 6 months to get this coverage through the state or federal high-risk pool. Explain that one a little bit, Richard.
This is one of the best provisions in the bill. Unfortunately, now, it doesn't kick in for everybody until 2014, but for children, which is up to age 19, it already kicked in. And what it means is that if you're insured or you're buying insurance, you can't be denied coverage for a pre-existing condition. So people with pre-existing conditions who are insured at least 6 months can get the coverage through a state or federal high-risk pool. So what does that mean?
It means if you're pregnant, for crying out loud, you can
Right.
get insurance. A lot of women, couldn't get insurance.
Well, in Vermont, pregnant women can get Dr. Dinosaur, so
Right.
it's a lot
That's
better.
good. Well, in Vermont, our kids are also taken care of.
Yeah, we're a lot better off.
And I hope you can keep your thought, but what will that do? Since we have Dr. Dinosaur in this state, when I read that, the first thing I was wondering if that could save Vermont any money at all, because we pay money to insure our kids. Will this help us?
Yeah, the answer to that is nobody knows yet.
Okay.
And this is a big problem. All the states are in the same boat. They're trying to figure out what the implications are for each individual state in terms of this bill, and it's so complicated. So nobody really knows. Vermont's way ahead of the curve, and one of the fears that people in Vermont had when the bill was getting passed was that we'd be penalized for being ahead of the curve and we wouldn't get as much money, but it's starting to look like that's not the case, but nobody really knows yet. And we're not getting really good answers.
And that's why I think the scare tactics work.
They work because
nobody really knows a lot of this stuff. So as long as people are throwing that garbage out there.
Yeah, but we've dispelled some of the major myths here.
Hopefully.
Yeah. So, and now this relates. So what is this high risk pool all about? So this is important. Okay, if you're up to 19 years old, if you have insurance, you can't be denied coverage for pre-existing conditions. In 2014, that will apply to everybody. So no matter what kind of insurance you have, if you sign up for policy and you had a cancer that was diagnosed, they can't deny coverage for a year like they used to do, or they've been doing now. So then part of the bill would require these high-risk pools to kick in for a while, and you have to be uninsured for at least 6 months to be in the pool. Now, one of the hopes was that Vermont would take the Catamount program and make that eligible to be a high-risk pool. We got turned down on that.
By the feds.
Yeah. And it's not clear why. People are confused. I've been talking to people in New York and California, like a whole bunch of states, especially the states that have community rating and guaranteed issue, which are almost all the New England states and New York. So there's 5 states that have that, and they're confused. They're not sure how to create.
You might want to just,
pool.
for the heck of it, just give a quick. We don't have much time, but talk about the community rating thing, because to me, Richard, that's huge.
All right. So.
And I'm glad all New England states got it.
Right, and this will be the bill. The federal bill actually has a modified form of community rating. And what is that? Okay. What community rating means is that if you are in a, and generally it doesn't apply to like a whole state or the whole country, but if you're in a group, like a certain insurance group, like a group plan, everybody in that group, no matter what their illness or their age or their smoking status or anything, everybody pays the same price for policy. So the definition of community can change. So in the federal bill, they put in so many exceptions, so they watered it down quite a bit. So if you're a smoker, or if you're over a certain age, then they can charge a certain extra percentage, even though you're in the group. So they watered it down, quite a bit. But the concept's there, and hopefully that's one of the provisions that we'd like to see have a little more
Just
teeth in
stops
it.
cherry picking, in my opinion, and puts everybody in the same basket instead of letting them throw some people out of the basket and keeping the healthier ones in, like maybe the 20-year-olds who are healthier, and so that's why I'm a community rating.
Yeah.
I think you need to do that, or some of us will be priced right out of the.
Well, what happens in places where there's no community rating, even if it's a modified community rating, is, say you're HIV positive, or you have a history of breast cancer, and you start using more of their services. Well, they can start jacking your rates up every year, and what they try to do is price you out. So, it's not uncommon for somebody with those problems to get a bill, or they get a notice. Next year it's going to cost you $30,000 for policy, and I'm not exaggerating.
No, I know.
And this is what they do, and so
the other side never brings that stuff up.
Right.
They seem to miss that one.
Right, they miss it a lot.
Yeah.
So these states, which is, let's
unreal.
see, 45 states, they can do this. They can just say, well, you're costing us too much money, so you know, your policy is going to be $45,000 next year.
And this is what kills me too. When I look at results through polls and all this kind of stuff on regions and their healthcare outcomes, the Northeast constantly is on the top of the heap. And Vermont is either 1 or 2 usually. And the reason why I think, well, for Vermont, it's a lot of things. It's Dr. Dinosaur and a few other things. But I think it is the community rating.
Well, I think it helps. You know, the other side of the coin is people say, oh, there's not enough insurance companies here to have competition, and the community rating drove them away. And, and I say, good riddance.
That's what I say too. See ya.
And because
I don't understand that philosophy. I mean, I know it's grabbing as much as you can right now, folks, but what about the long term? What about the long haul? And I could get into like some other things, but we're talking about healthcare matters here. But geez, we're just into the quick fix and the quick money, and nothing is thought out. So anyway, Richard, we got to wrap up. We probably only have about maybe 4 minutes left. I'm not sure.
You think so? How much? I wonder how much.
I'm waiting for our Joe to give me a little 4 minutes.
4 minutes. All right.
So how would you like to recap what we're talking about?
Well, let's just run down the list very quickly, and that will help.
You do that.
Okay. So a lot of the lies and incorrect statements about what's in this federal health care bill relate to Medicare. So first of all, Medicare benefits are not changing. The program's not being cut. If you have regular Medicare and not Medicare Advantage, you won't see any change. But you'll see some positive changes. One of those changes will be that you don't have any copays and deductibles for preventive care. So, and then you possibly, if you're in the donut hole under Medicare Part D, you'll get a check for $250. And Medicare is going to actually have more money in the Medicare Trust Fund over the next 12 years, so solvency is not an issue. So anybody that is telling you that Medicare is going down the tubes because of this bill, they either haven't read the bill or they just want to lie to you and not tell you the truth.
They do that for everything, though. They do the same thing with Social Security. Hey, listen, there's people out there that are very good at telling scare tactics. It's scare tactics, and why the hell we as a society vote for them people is beyond me.
Well, people like to play that game, you know, and people like to jump on board. I got an email the other day, and I can't remember the exact content, but it was one of these lies, and I refuted it, and the person I refuted it to, they didn't care whether it was true or not.
No.
You know, it was like, it was a bigger issue about government and government control, and it was like, well, big deal, so it's not true, but, you know, and it's like, wait a second, what happened to the truth? Isn't the truth important anymore? No.
No.
No, it's not.
No, it's not.
It's not. You know, so what are some of the other things in the bill? So children up until age 26 can now be on their parents' plan. Of course, it might cost too much to afford. And then people with pre-existing conditions, if you're up 19 years old now, you can't be denied coverage for any pre-existing condition, which is tremendous. And then 2014, that applies to everybody. So that means that no matter what insurance policy you buy, you can't be denied coverage for something that you were treated for a year ago or 10 years ago or yesterday. Can't happen. So those are the things, and I guess that's about it for now. You know, hopefully we've dispelled some myths. I have a PowerPoint presentation on the Medicare, the true story about Medicare and the health care law, and people can call me or email me the information at the end, and I'd be glad to do a presentation to any group, you know, and come out there.
I'm thinking maybe we should do it on our show one time.
Well, we could.
I think that, you know, you could go through this PowerPoint. I think that wouldn't be a bad idea, really. Maybe, you know, look for that in an upcoming edition. Well, we're going to have to go, Richard. It's time to
go
say goodbye. We got our last minute. How would people get a hold of you to discuss healthcare
Well,
issues?
It'll be at the end of the show. You know, we'll have
that's right.
the email and the website and the phone number. But just in case you're too lazy to, I'll just mention it. That's okay. I guess you'll see it at the end.
Yeah,
I won't say that.
Our producer's up there doing something through the.
All right, we're finished.
I guess we're done.
All right, bye-bye.
We can say goodbye now. Oh no, he's shaking his head. We've probably got to talk for another. No, we're done. I don't know. There's all sorts of fingers going up, and which finger is that?
Goodbye.
You know.
Goodbye.
Ciao.